Reid. Great to meet you. Thank you so much for taking a minute after the program today. I appreciate it.
Yeah, thank you.
So I always begin with this question, and I've tried to get rid of it, but it just always seems relevant. 6 years ago, this pandemic put a lot of us at the crossroads of our existence. What are we going to do? How are we doing it? How did you get through that era? And how has it changed or transformed the way that you live and work today?
Yeah, that's a really kind of deep and thoughtful question. I think all of our lives turned upside down. I pretty much refused to get locked down to the extent possible. So I headed out. I was on one of the first planes when they started flying again. I literally was traveling when there were more people traveling with me than there were hotel employees. Folks were saying, "Hey, we can drop towels outside your room and and I was like, no problem. So I tried to get out and engage as much as possible. And I will say, being in Atlanta and being in the South, I think we were far more open than other places that I traveled to, which really helped with um, health and mental wellness. I mean, we are not made to be isolated. And so at the same time, from a business perspective, I mean, Zoom became a tool that we all utilize. Teams became a tool that we all utilize. We started engaging online. Our business, in a matter of 1 week, went from in office, probably 70 people in office, probably another 30 employees, 20 employees at the time in other offices, to 100% remote. And 100% remote required a transformation of telephones, required a transformation of computers, of online. Now we utilize an online platform that manages complex claims in the healthcare space. And so it was largely remote, but we were still used to going into people's offices and sitting down for meetings and meeting together in office. And all of that changed overnight. So there was an incredible amount of kind of resiliency and transformational energy that occurred where we learned to do things differently and we learned to adapt and do it very quickly. That raises a whole bunch of questions as why the heck did we used to take so long to effect change, right? What was it? What was it that was holding us up, right? The amoeba that just kind of moves in the same direction that it's moving out of inertia, right? So how it changed me, I think there's really two different paths to go down. So personally, I don't like being alone. I like being with people. I like getting out. I pushed that envelope as much as I possibly could. And the South really enabled that much more so than other places that I traveled. From a business standpoint, I now today ask the exact same question in every meeting on every company that I sit on the board of. I'll take a look at their technology or their business roadmap, and they've got the stuff they're working on this month. They got the targets for this quarter. Then they've got the annual goals, maybe a 3 year or a 5 year. And I'll just say 5 years, like, what are we talking about that for? And what is it that's preventing 3 year goals from being accomplished in 12 months? What is it that's preventing 12-month goals from being accomplished in 6 months? And what resources do you think you need in order to accomplish those in the shorter time period? So the shutdown really did that because those things that we were working on and had longer term time horizons, in some instances, happened overnight.
So let's get into the exact work you do. Your business model is fascinating, and I want to put you in front of 12-year-olds. You're at career day, and one of the kids wants you to synthesize your day job to make sense to their brains.
Yep. And that's a great way to think of it, by the way, when we talk about either elevator pitches or talking to 12-year-olds, right? Because we all get overly complicated in our own little worlds.
Yeah.
So, healthcare providers see patients who are uninsured or underinsured. And every 12-year-old in the world should know, or certainly in America should know, that there are 30 million people roughly who are uninsured, and there are 100 million people who have less than 4 weeks of savings in their bank account. And if they're hurt, whether that's you, 12-year-old, or your brother, or your sister, or your mother, or your father, or your grandmother, or your aunt, or your uncle, or your friend, and they're in those categories, there's almost no chance that they can receive the care that they need. So we take doctors and patients and pair them up, and we collect that money for doctors who are seeing these patients who are uninsured or underinsured. Because 12-year-olds, the healthcare system in the US is too complex, and you should be able to understand it. So what you should understand about our business is we're seeing patients. Doctors are seeing patients, and we are collecting money for doctors that they otherwise wouldn't collect, and those patients would otherwise not receive care. Technically, we're a revenue cycle management company. That's not going to make sense to a 12-year-old,
Yeah.
right? That collects complex claims for doctors. But 12-year-olds should know this is 100 million Americans who need our help.
What did you want to be when you were that age? When you were at career day, what was your dream gig?
So my choices were pretty early, and I had a unique childhood that was an absolute blessing. I left the States when I was 7, and I came back when I was 18. I first went to Adelaide, Australia, and Adelaide was wide open, and Australia was wide open with more sheep than people. So I learned to race motorcycles and break horses and really live outdoors. And then in junior high school, I moved to Tokyo. And so in Tokyo, I'm in a big neon playground for all of junior high and high school. I graduated from high school in Japan. And so those career days were amazing because I got to see and hear from multinational executives that were stationed in Japan. In those days, Asia was really run out of Japan, and foreign nationals were there running companies out of Japan. So I got about a third of my classmates were international students, about a third were American, and a third were Japanese. So I got to see a tremendous amount of business executives at a very early age. And one of those executives, a gentleman named Stephen Stonefield, ran Morgan Stanley's fixed income operations in Asia at the time. And at that time, we had to read the Wall Street Journal, right? It wasn't all available online. And I was reading this stuff and I was super intrigued and I was super interested. And I didn't know exactly how the treasury markets worked. I didn't know how the stock market worked. I didn't know what convertible bonds were. And I was looking up all of this information. And Stephen Stonefield, who was the father of a good friend of mine, answered all of my questions. And all I knew was that I wanted to be him. Even though I didn't know exactly what he did, he was one of those adults that was so influential on my life by answering my questions, not making me feel stupid, and further encouraging me to explore finance.
You know, it's interesting. I was thinking about what you're doing and how the healthcare model works in America in a capitalistic world. And I wonder if you were to have been in Canada or in Europe in a socialized medical world, hypothetically speaking, would this business model even exist for you? How much
So
if
first of all,
yeah.
go, sorry,
No, no. I just wonder how much of that would have changed and altered a Back to the Future way, your future.
let's go. It's not theoretical. I lived in Japan and I lived in Europe for 7 years.
Okay.
I lived in the UK and I lived in France.
Okay.
I lived in Switzerland. I lived in Sweden. So I can tell you firsthand, do not be enamored with socialist single payer healthcare systems. They do not have the same resources for research and development that we do here in the United States. And they do not give access. The worst thing possible is, Joe, I am worried. You're my friend. You have a condition. You need to be treated. And I am worried that you are going to see that appointment in time for that to not progress too far, time so that you don't die. And so what happens in those is there becomes this bifurcated public and private market. So they talk about this single payer stuff, and it's terrific if you have a scrape on your arm, or if you break a finger, or if you have the flu, or if you need something that's kind of very specific and identifiable and easy and clean, something that's able to be treated. Our answer here in the US is kind of nurse practitioners and urgent care centers. It's fine for that. But for complex and or big ticket, longer term items, socialist systems, single payer systems are disastrous. And the private sector that goes out of that bifurcates the intended system to begin with. And what I mean by that is you've got money. I don't. I have to stay in that single payer system, whether I live until I actually see the doctor that I need to see, or whether my terminally ill condition progresses beyond repair. That I don't have a choice. You have money, you go to the private sector and you pay a doctor to see you sooner.
Yeah.
So what I would like to see is our system, not with United Healthcare and Kaiser and these other, healthcare insurance companies that are for profit, that on one hand are announcing $12 billion in profits, and on the other hand, a week later are sending out doctors notices that say, due to the unbelievable rise in the cost of delivering care, we're going to have to decrease your reimbursements another 4%. Right? Nor should we continue to rely on Medicare and Medicaid and think that these are untouchable. Medicare, Medicaid, and Social Security are only untouchable because it's unelectable to tell people, elect for me, I'm going to take things that are unsustainable away from you, right? Because the other candidate on either side, it doesn't matter, just says, I won't take those things away from you, and they get elected.
Yeah.
Right? So by default, we're protecting systems that need to be upended. That doesn't mean people end up without care. It means the capitalist system that is far more efficient at delivering services with a dollar than government is. That is a fact. We can talk about it across the world. Governments are inefficient capital deployers. End of story. So working within the capitalist system, but more like a utility. And what is a utility? A utility is something that we determine that all people should have access to in this country, and that they deserved to make money, but that they had to spend some of that money on reinvesting in themselves to make themselves more modern, more efficient, right? 47%, and I'm using a number from a specific company, but significant dollars are spent on administrative waste. Administrative waste. So they should take those profits, they should reinvest, there should be efficiency metrics that we're tracking. They should take those profits and pay them out in dividends, and they should not be invested in purely as a capitalist vehicle. And I want to just point out, 1994, this is when it turned on its head. Allstate hired McKinsey. McKinsey came in. There's tens of thousands of pages discoverable online after they paid a $2.5 million fee for not disclosing them. You can now see it. They went to the board of directors at Allstate and basically made the pitch for being a for-profit entity. And whereas it used to be run for the benefit of policyholders, they shifted that focus to for the benefit of shareholders. And what happened was Allstate's profits went from roughly $240 million in 1994 to 10 years later, $2.5 billion. And that was because of the implementation of Colossus. Colossus, do not kid yourself, is a claims denial platform. And today we have every frustration that anybody listening to this experiences. How many claims do you have with your commercial insurance that are denied? Denied for what? Who? What adjuster has the right to deny that claim?
Yeah.
Right? But if they're run more efficiently, they're not back and forth. This is not a bill. This might be a bill. This could be a bill. We've taken this write-off. Back and forth and back and forth and back and forth. Cut it out. get to more efficient approvals of necessary healthcare to take care of people. Move the system to proactive healthcare. Pay for people's fitness regimes, pay for people's morning routines, pay for people that are proactively taking care of themselves,
Yeah.
and have them be more like utilities. But the single payer socialist system is a disaster. Don't get caught in that lie.
So who's been your inspiration in your life to navigate from your dream years early on to today? Who's been that hero for you?
I don't know if there's a single hero. So my mother has been an unbelievable inspiration, has been a supporter throughout my entire life, through all of my failures and modest successes. As a thinker in the 90s, I really loved Newt Gingrich as he was doing Say What You Want. He's a historian. The Contract with America talked to both sides of the aisle, got government more efficient, worked towards balanced budgets, which we haven't seen from either side of the aisle for a long, long time. Um, I've loved when I was in investment banking, I was part of kind of the Sandy Weil roll up that became Citigroup, and Jamie Dimon was his longtime right hand chief of staff. In the finance world, there is just really very few brains like his. There are folks at Renaissance Partners and Jane Street that are quant shops in the hedge fund world that I find absolutely brilliant. And the combination of physics and statistics that they've implemented into kind of quantitative trading, I think has changed the world of finance. And I truly, truly admire them. I just don't think you can go anywhere in today's world without recognizing the accomplishments of Elon Musk. I don't know him, but the fact that somebody has changed so many industries and is pushing so many boundaries, I find absolutely intriguing, fascinating, and inspiring. There is no way that I could keep up the schedule or do anything close to what he's done, but I find that incredibly inspiring. And then I've been in recovery for 17 and a half years. And the only way that I have had anything successful in my life is giving it up to God. And so that can be a very, some people don't want to go down that road. So I will say to them, then pick your higher power. It doesn't matter. But I only have success in my life when I get out of my own way and I get out of self. And so that is the overriding, guiding force in my life.
So, for most people in the world that think about healthcare and how things are paid and how services are delivered, it can make your head spin. There's
Yep.
so many, it's like 1,000 clocks just spinning all at once. And you're in control of this company that's trying to be kind of an ombudsman to make it make sense. What's the energy for you every day to do this at a high level, to make it logical, to keep up with this advent of this modern world driven by AI, and then take care of your own soul? What is that for you?
So I love having listened to your podcast, kind of the focus, I'll say, where you will turn things towards mission being bigger than business, right? Or if you will, like, what is the mission of what you're doing and how is it that you're driving towards it? And I really have appreciated that. And as you pull that out of people to see really what's at their core. And for me, gain servicing is not selling widgets, right? It is not making money. Money is the byproduct of an offering delivered well. And what well means is for the benefit of patients, for the benefit of healthcare providers, for the benefit of attorneys, making all of their lives easier. And for me, the mission that gets me up every day, because it is a headache, right? You are looking at third-party liability carriers denying every single one of these claims. We are servicing over $2.5 billion in healthcare claims, 100% of them have been denied or are being objected to by third-party liability carriers. And all of them, from our review, it's using the word all to say 100% of everything in life is never true, just like saying zero, right? But all of these claims are necessary medical claims. These are people who have been hit by a tractor trailer, right? That have broken their arm, that have suffered traumatic brain injuries, that are handicapped, that have been out of work. These are not claims that are made up, and they're being denied, right? And then they have to go through litigation. So my point on mission kind of versus business is there is a greater good. These $2.5 billion in claims should be paid to the healthcare providers who have provided these services. These doctors have done these on lien. They have not been paid. And it's only through a litigated process that they're getting paid. So my point in terms of mission and kind of what's driving and what creates the energy around it is you're not just trying to solve for getting a doctor paid. You're trying to solve for access to care for the 100 million Americans who don't have access either through underinsurance or uninsured, right? So that they're able to see physical therapists, imaging companies, pain management doctors, orthopedists, etc. Number two, we're then trying to get the doctors paid. So overall, we believe in the greater good and the access to care for those in need, regardless of payer source. So the energy that comes every morning in our morning meetings with management at a senior level is how are we advancing that goal? How are we having more patients receive necessary medical care and more doctors get paid for their services sooner?
You know what keeps going into my head when I hear you talk about this scenario, and I think about the fabric of America and how things work. I remember years ago, I have a jazz radio show, and I went to a benefit at one point. It was at the Gem Theater off 18th and Vine, a historic jazz district, and it was called the Coda Jazz Benefit Concert. And there was an old guy there named Claude Fiddler Williams, one of the oldest, most heralded violinists in the world of jazz. And they were all there to raise money so that there could be monies to cover funerals for musicians that don't have health insurance. And I was thinking about a lot of those guys that didn't even have health insurance and how vital what you're doing is. Just for that one episodic place in 1998 on my timeline. Like that these people, because there's bankruptcies, lives get ruined because they can't afford things.
Right.
Or that section of people that don't have the money and they don't have the savings. It's gone, man. I mean, it's like, and you never know in this life. The machinery of accidents happening is just like the most unpredictable thing ever, but it
There's
can completely ruin.
there's $30 billion a year in just motor vehicle accident medical bills, as an example, right? You think that treatment's unnecessary?
Right.
And yet third-party liability carriers and health insurance carriers are denying those claims and or pointing fingers. What's even more frustrating is they're pointing fingers at each other as to who should pay.
Yeah.
Like, are you kidding me? Health insurance, pay it. If you then want to go to talk to a third-party liability carrier, that's your business. Don't bother the patient with it.
Yeah.
Third-party liability carrier, your driver's at fault, pay it. People talk about runaway verdicts and they talk about needing tort reform. That's the biggest BS that we've ever heard. And that's run by the insurance company and lobbying groups that spend billions of dollars on our politicians to say, oh, frivolous lawsuits and runaway juries. You know what a runaway jury is? A runaway jury is when they listen to all the facts. They see that the company is so complicit, so bad acting, and so negligent, and have delayed for so long that they hammer them with punitive damages. And oh, by the way, they had every opportunity to settle for years along the way. You think that plaintiffs and attorneys don't want to get these claims off of their books? It is only when they are delayed and denied and delayed and denied, and a jury listens to that and says, no, spilled coffee, right? Everybody saw it on the New York Times when we were kids. $2.3 million paid for a spilled cup of coffee. Oh, that sounds awful, doesn't it? That sounds frivolous, doesn't it? Until you watch the documentary and you know that the 70-plus-year-old woman took a cup of coffee at almost 200 degrees with a loose top, spilled it, and mutilated her genitalia.
I saw that documentary. It was
Right.
crazy.
Crazy.
Yeah.
$800 is what they offered her. She had $10,000 in medical
Oh, yeah.
reconstruction bills, and all she did was ask them to pay for that.
It,
So, of course, you get to a jury and you find out, oh, gee, McDonald's is protecting that practice because they sell millions of dollars in vats of coffee to construction sites. So they started off at 200 degrees so that it can remain warm out in the field, right? Not so you can hand somebody a cup of coffee at 200 degrees through the drive-through window.
yeah.
And it had to go through that process for them to say $2.3 million, mostly in punitive damages, which she then settled out at $650,000. Like, what in the world is egregious? Pay the lady
Yeah.
the $10,000 that she first asked.
Yeah, no one knows that story either. They just think it's, it's lawyers gone wild, but it was bad. They showed the scarring and it was terrible. I
It's
had no idea.
awful. And so that's the example where the insurance industry says these are runaway juries. They spend billions of dollars. They talk to the politicians and say, look at all of these greedy lawyers. They coin phrases like ambulance chasers. I'm sorry, I haven't seen an attorney chase an
Yeah.
ambulance, but right, it's very effective. It sounds horrible. You and I don't like the sound of that. Nobody listening likes the sound of that. Frivolous lawsuits. Oh, that sounds bad too. What are you talking about? Pay the claims.
Yep.
Nobody has to hire an attorney if you just are paying the claims, if there's a process to be reimbursed. And oh, by the way, carriers oftentimes are like, sure, 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 let's pay that because they don't want to listen to how long you may be disabled for, what future help you may need, right, as a result of these injuries. And they're also liable for that. So they're trying to get this off of their books as soon as they can for as little as they can. No, take into consideration all of the current injuries, all of the future needs, and pay that amount.
So let me ask you a question. You've seen a lot of lands, a lot of cultures, lot of, lot of things in this world.
Yep.
And after all this time, let's say you had a dream tonight and you ran into the 18-year-old version of you and you walked into a room and there was a film projector and you clicked play and a 60-second highlight reel of how your life has turned out up to this point came up. Would that young version of you believe your life turned out this way?
I had been to every continent except Antarctica before I was 16,
Wow.
and it gave me an incredible perspective. And I said this right at the beginning. I was unbelievably blessed. My parents were high school sweethearts. They were from Detroit. My father grew up in the Brewster Projects. He came from absolutely nothing. My mother and he were both the first to ever go through university in their extended families. And my father took a flyer to go overseas on a job. So early on, no clue. But as I then got to work through all of these countries on all of these continents, see so many things, what I realized very early are that people are all the same. It is just cultures that are different. And so from very early on, I became culturally curious, right? We look different, perhaps, but we are the same.
Mm.
It is just how you practice celebrating manhood, celebrating womanhood, celebrating marriage, celebrating death, celebrating life. It is those celebrating holidays, which holidays you celebrate, what the traditions are. Those are cultural things that bring groups together. So the world for me at a very early age became small, not large and overwhelming. It became, that's why when I was an analyst on Wall Street and was offered the opportunity to move to London, I said yes as soon as it came out of their mouth. I was on a plane the next week living in London. There was no fear. There was no like unknown. There was no, it was like, I am absolutely confident that people are the same, that their cultures will be different, and that I will be able to learn if I listen and observe. If I don't go over wearing a fanny pack, if I don't go over wearing a baseball cap, if I don't loudly insist on somebody speaking English to me,
Yeah.
if I just listen, in answer to your question, I have had modest successes and tremendous failures, and I have bounced back from those failures. At 18, would I have envisioned the failures? No. Would I envision the career path? Just the first part of it. I then became an entrepreneur, a business owner, and operator, whereas I started my career in investment banking. So I would have seen and been comfortable viewing the first part of that career and then had no clue where it took me after that.
So in that 60-second highlight reel, what are you the happiest about?
Uh, Two things, three things. My parents are still alive. I have three absolutely amazing kids that I have tried to pay it forward with and make them real decision makers themselves. Kate's living in Paris, incredibly successful early in her career. Jane's living in Nashville, working for her dream job. And my son Reid has committed to UCLA and is so excited to move to the West Coast this fall. I'm unbelievably proud of them. In addition to kind of success, if you will, so far, they are kind and empathetic and thoughtful and faithful. And it is an absolute joy to see them grow like that. I think on the professional side, there's two things. Number one, I had a tremendous failure in which I over levered the buyout of a company that stuck a lot of contingent liabilities around my neck. And bankruptcy was really the logical answer and what was suggested by many. And I refused to do that. And although it took me about 5 years, every debt holder was paid off. And I take a great deal of pride in how my worst professional experience, or on paper, worst professional experience, was resolved. And then lastly, today, there's two things in the highlight. Helping, it's a $150 million business. It's employing 130 people. We are servicing, as I said, $2.5 billion in care. That is $2.5 billion in care currently that we have made sure was provided that otherwise wouldn't have been provided. And lastly, the highlight that I have is I am healthy, I am active, I am clear-minded, I am sober, and I pursue adventure travel to a large extent as often as I can. So I love large, dangerous underwater experiences. And by large, I mean large animals. And so the highlights from some of those and the reels are both peaceful and exhilarating. So those are just a few things all over the map. I apologize,
No,
but
I
that
love
I'm
it.
incredibly grateful for.
So as a well-traveled soul, I gotta know, if you could get into a time machine and go back in time and see one event in human history, you get to see it with your own eyes unfold. Where are you going? What do you want to see?
That's a great question. So I am a yes is the answer. Just tell me the question. Um, I have said that to people forever. I made one mistake. I was living in London. Reagan was giving a speech in Berlin. They were bringing down the wall. I could have got on a train or a plane and I could have gone. I thought about it. I hesitated. I had a lot of work. I go all the time at the drop of a hat on any trip. And it's the only travel regret that I have. I
Wow.
didn't get on a plane or a train and go to
Wow.
see and experience the coming down of the Berlin Wall, the reuniting of East and West Germany. And I really wish I had done that. That's just one very specific kind of modern example. And I think something I would have loved to uh, I would have loved to be in the halls of debate as we were forming the Declaration of Independence and as we were writing our Constitution, and all of the kind of early thinkers and debaters. I think that that would be an incredibly meaningful time period. And if I ever had the chance to go back and then come back forward, I think it'd give me an unbelievable perspective as we today talk about our Constitution and today talk about our political divides, and today to kind of see that debate that existed, that was, as you read about it in history, incredibly intense, yet came out the other side incredibly united.
So we got less than a minute here. I'm going to put links in Gain. We did good work here. Reid, what a joy. Thank you, sir, for the work you're doing. It's been an honor to be able to get your story, to be able to put it out in the world. It's such wonderful work. So thank you. I really appreciate it.
I appreciate you.
Yes,
Very
sir.
much.